Hi, and welcome to the channel. My name is Tony Maritato. I'm a licensed physical therapist, and if you've been following the YouTube channel or the Facebook group, the closed Facebook group, I shared a video of a wonderful woman who was working on kneeling. Now, she was actually working on kneeling at home on her own, and I had asked her to show me what she was doing, how she was getting down, how she was getting up. And this is just a fabulous story. What I'll do is I'll go ahead and put a link to the original video up here, but I wanted to take a couple minutes to talk to you all about that experience and some of the comments. I'm looking at the screen behind me. Some of the comments that were left on the video after I shared it in the Total Knee Replacement Support Group for Kind People on Facebook. So this particular individual, what's so fascinating about this, and I've been in this game over 2 decades, and I still am fascinated when I see situations that clinically don't totally make sense and just take a little deeper investigation. So this lovely woman has been coming to therapy for a couple months. She's doing phenomenal. She is frustrated, certainly justifiably so, because she has a surgeon who is making her feel bad because the range of motion isn't where they want it to be. And while I understand in the clinic, when I first see her for a new session, the range of motion probably can't even get to 70, 72 degrees of flexion. But it's a guarding that's keeping her at that range. As we talk, as we relax, as I massage the muscles and kind of work on just desensitizing the knee, the range of motion continuously improves to the point where I can literally, if I just hold her ankle, I don't even press into flexion, I can feel her relax. I can feel the musculature loosen, the resistance relax, and she'll get 2 or 3 more degrees of motion. And with time, it'll take a good 12 to 15 minutes, we'll get to about 90 degrees. But if you were to just see this individual and say, hey, let me see how far you can bend your knee, you'd be lucky to get 70 degrees. That's just the way her body's responding to the procedure. So I was shocked, genuinely shocked, when I said, okay, well, let me see how you're doing with the kneeling. The reason why I like kneeling is because I believe kneeling is one of the best ways to continue to improve knee flexion, especially when a patient has gotten to or beyond 90 degrees of knee flexion. Now, there are lots of different forms of kneeling. In this video, she's kneeling down on the ground. She's got a pad under the surgical knee. But I want everybody to understand, certainly there's a huge difference between kneeling on a hardwood floor and kneeling on a mattress or a cushion from a couch. There's also a huge difference in where you apply the pressure when you're kneeling. So a lot of times in the clinic, when I've got somebody who wants to be able to kneel for whatever purpose, they're anxious about kneeling, the knee is sensitized, the incision is sensitive. What I'll do is I'll apply pressure at the shin bone rather than on the knee or the incision itself. It's still a form of kneeling. So usually we'll either put a cushion on the floor or we'll put the bench in front of them. You've probably seen me do videos like that. And so if you pretend and it's upside down, the foot would be here, my middle knuckle is the knee. The pressure is actually off of the incision in the knee, and it's more on the shin down to the ankle. So there are lots and lots of variations on what we would consider kneeling. We could do kneeling in a vertical, horizontal position, not just on hands and knees. We can do it on a plinth or a mattress. There's lots of places to do it. But the point being, what's so interesting about this particular case is her range of motion was very limited if I tried, as the therapist, to move her into flexion. But as soon as she got down on the ground, she achieved full 90 degrees plus knee flexion, even before I turned on the camera. I told her I wanted to record it because I wanted to share it with everybody, and of course she agreed, and we have consents. But the idea is, as soon as she got down, she was able to achieve a range of motion that I would never be able to achieve for her as the therapist. And I don't blame her, because I wouldn't want somebody pushing on my painful knee. I would do it myself to a greater degree than I would ever let somebody else do it. So a couple of questions that came up in Facebook that I wanted to address. Somebody said, Tony, why does it feel like I'm pressing on a ball of gel that will burst? Well, part of that is when you think of the structure and the anatomy around the knee. So the knee has the bones, and then the ends of the bones were cut off and replaced with the implants. But then surrounding the knee joint is what we would call the joint capsule. It's thick connective tissue. I describe joint capsule like a canvas. If you think of canvas, whereas the muscles would be more like rubber bands, the canvas will stretch, but it's very slow to stretch. And as you pull and stretch thick canvas, there's going to be some tearing that could happen, but eventually the fibers will start to stretch. Canvas will stretch more easily when it's warm. If I threw a piece of canvas out in the snow and let it get cold and then I try to move it, it's going to be really stiff until those fibers start to warm up a little bit. So the joint capsule has fluid inside, has fluid outside, and as you go into that first bend of the knee, it is exactly like you're saying, this thick gel pulling that feels like it wants to rip open. It's likely not going to rip open, assuming everything is healed up normally. And I know you are way beyond several months post-op, probably a year, maybe 2. I know you've been in the group for a while, but that's normal. So 2 ways around it. One is you have to give yourself time. So in the beginning of this video, I said when I'm stretching a patient's knee, I'm expecting 12 to 15 minutes before we get any improvement in range of motion, because I'm loosening up, warming up, decreasing the guarding, and that kind of fight or flight response that happens when you first bend a joint that you're concerned about. For you, it's going to be the same thing. So either you're going to go into position slowly over minutes of time, not seconds of time. And the other thing that I find that helps quite a bit is the compression wrap. So if you've seen in other videos, I've got a red and white or a blue and black compression wrap that I use. And the reason why is it creates a counter pressure. The fluid inside the knee is wanting to push out. And when people tell me what you said, I feel like the knee wants to burst. It's because that pressure is pushing out. So if we wrap the knee to create compression that counterbalances the inward to outward pressure, we're getting inward pressure, it tends to be more comfortable. The knee feels more secure. You can bend the knee a little bit more quickly, get into that end range position easier. So those are 2 things that you can consider. I know a lot of people were saying no, they've never tried kneeling, they don't want to try kneeling. That's totally fine. There's certainly concerns about bone tissue quality. I would never tell somebody that I haven't evaluated to start kneeling, simply because, you know, if there's something wrong, bone weakness or anything, there could be complications with it. And my definition of kneeling is generally very different than other people's definition of kneeling. So just looking to see if there are any other questions that I missed. People having a hard time getting back up if they do kneel. I've got some videos kind of showing, and the way this individual patient gets down and gets up is a classic way that people will do it at the front of a couch when they want to practice kneeling. So look forward to it. Kneeling on the carpet for short periods of time. Some people got knee pads. Scars too tender. So like this, somebody had mentioned that the scar was tender at 8 months on one knee and 8.5 weeks on the other. I would tell you that if any of you are still dealing with sensitivity in the scar, beyond 6 to 12 weeks, we want to start doing some desensitization strategies. Now, it could be something as simple as a soft bristle brush. It could be something as simple as a washcloth. All the way through, there's some rubber suction cupping strategies that I've shared on the channel. There's all sorts of instrument-assisted soft tissue mobilization things. None of it should be painful. None of it should cause any kind of damaging or bruising. But it's important that we understand that we want to desensitize that incision. There's no reason why it should stay sensitized, but you need somebody that you know, like, and trust who will help you through that process, because you don't know. You don't know what the difference between normal sensitivity versus causing damage is. That's really the goal of the therapist. The therapist almost doesn't matter what they do. It's that it's somebody that has experience and that you can trust and that's on your team. And if they don't know the answer, like there's tons of stuff I don't know, I go look it up. I find it. I know where to find the information. I think I might. So 15 months post-op, I don't. Why put myself through that? You know, that's an interesting perspective. So this individual is 15 months post-op. They don't do kneeling. Why should they? You don't have to. Like that's the absolute honest truth. I know individuals who, if they fell on the floor, they couldn't get up. My concern would be what happens in the emergency situation. What happens if, for whatever reason, you need to get down on your knees, or you're forced to get down on your knees, as in you slip, you fall, you have an accident, there's nobody around you to help get you back to position, you can't reach your cell phone. Sadly, I've had situations in my clinic in the 21 years of clinical history where we've had individuals that have fallen outside, they can't get up, and they've never gotten up. So, nobody wants to be in that position. Nobody wants their children to find them like that. So this is a situation where if somebody's capable of doing it, I would want them to have all of the tools and resources to be able to do it. That being said, you're not forced to do it. Nobody has to do it. It's a personal decision. Some people value that. Some people don't. I'm not placing judgment on it one way or the other. I just want you to know that it is possible. And if you want to develop that skill, there are people there that can help you. All right, guys. Hopefully I didn't offend anybody. I will talk to you guys on the next video. Thank you as always so much for watching.